Hello, everyone. I'd like to call the February 25th Buncombe County Health and Human Services Board to order. I'm glad everybody had a chance to get here. I'm afraid for a while we wasn't going to be able to get here, but the weather helped us tremendously. I appreciate that. Glad to see everybody. We do have a new member. And as a result, our commissioner, one of our commissioners, Commissioner David King, is now a member of this board, selected by the Board of Commissioners to be here, and we appreciate you being here. Thank you. And we look for big things from you.
Well, actually, it's my honor to be here, and I think I'll take away more than I bring. So I feel very honored to be here, and I would like to say I'll learn a lot more from you than I can bring, and I hope that I can bring something of value. But I look forward to getting to know each and every one of you. Thank you for indulging. It'll be a good idea for a commissioner to understand the vastness and the ability of this committee. And I would like each of us to introduce themselves and what you do, so forth, and we'll take the time out to do that. So, Carrie, I know you know Commissioner Gaines, so we'll start with you.
Pardon me. Thank you. My name is Terry Van Dyne. I am a community volunteer, I guess you'd say. I've served on several nonprofit boards, and I'm pleased to be here.
Thank you. Richard?
My name is Richard Allen. I'm the veterinarian with the North Carolina Department of Agriculture, Director of the Western Animal Disease Diagnostic Laboratory.
I'm a community volunteer, retired from NC State University and University of North Carolina, Asheville, and Buncombe.
And I wanted to do, and I don't have all those things to say about myself. I'm just a
Just a nurse. There's no such thing as just a nurse. She takes care of me and heart path.
I've been on the board for a very long time. On the board.
Lenny is a force. She is a force. Stephanie Kaiser. I'm a pharmacist by licensure, and I work at Mission Hospital as Executive Director of Community Health and Corporate Wellness.
I'm Rick Barrow. I'm the Medical Director for the Department of Psychiatry at Mission Hospital, and I provide clinical services in the emergency room there and at the Buncombe County Detention Center.
Jennifer Way, the Executive Director with Community Care of Western North Carolina. We are a community-based healthcare delivery system for the Medicaid population, offering a provider network, care management, and quality improvement services.
I'm Sharon West, Women Veterans Program Manager, your representative of the VA, and in the community volunteer capacity.
I'm Frank Castellano, Director of Cardiac Emergencies at Mission. I'm a nurse.
John Whitener, I'm an optometrist, public health advocate.
Candace Toole, I'm the lead school psychologist for Asheville City Schools.
I think he knows that.
Well, anyway, I should say also, I just remember, John, this is the first time you've been here.
That's right.
And we're glad to have you here. And, although you were on the other health board, I don't want to make sure that you understand that we realize this is your first time and you need to be introduced to the group also. Thank you for serving. So, Mr. King, as you can see, this is quite a diverse group and very, very astute of whatever, and a very important part of this community. And we do have some members that are not able to be here. But again, we appreciate you coming and hope you'll have the opportunity to be at all of our meetings. I'm going to do my very best. All right. You had an opportunity to see the agenda. Have any questions about the agenda? And I'd like to remind you that you do your Liberty Board member to avoid both conflict of interest and appearance of conflict as we go through it. Anybody have any questions about themselves or any of the issues? Do I have a motion that we approve the agenda as presented?
So moved.
So moved. Second. Second. All in the discussion. All those in favor say aye. Aye. also have the board minutes of the last meeting, which was some time ago, but at the same time, have any questions about board minutes? Do I hear a motion that we accept them as presented? Move, second.
Second.
Move, second. Any questions? All those in favor say aye.
Aye.
Good, thank you. We'll move now to the budget, and so Jim, you will bring us up to date on that. We spent an hour with Jim before the meeting, and going over detail after detail, and he'll give you a summary of that particular meeting. Go ahead.
Happy to do that. Good afternoon. On your iPads, you should see the financials, the regular financial dashboard. We'll start with that. That represents the expenditure side for both health, DSS, and Parks, Greenways, and Recreation. As you'll see there, where you see the graph, the line that goes across, that represents where we are in the budget year. And then you'll see the green background that represents our spending patterns last year. And then the bar graphs that you see represent the spending of our current year based on the different accounting units that we have within the departments. I'll point out to you a couple things as I go through there. In the DSS budget, you'll see where we're above that line. One of those overall is in capital. That was because we made a purchase of a parking lot at the Cox Avenue facility, so that we now have one part that we now have secured for parking. In the accounting unit part of the budget, you'll see aging services is at 100%. If you remember, that's a contract that we engage with Council on Aging to provide those in Lando Sky Regional Council to administer those funds. So those funds are spent. We pay half at the beginning of the year and the other half at the end. In emergency assistance, you'll see that that's over where we should be, and that's because most of those services have already been provided. Those are emergency heating services that we provide in partnership with ABCCM, Evan Charities, and Swan Ministries. The other budget items within both health and DSS are on track, exactly where they need to be. Where the expenditures are under, it's because, particularly in Parks Greenways, is where we're not yet, for example, grants, we've not yet awarded those grants. They will be coming out in the spring. Do you have any questions that you see about relating to the expenditure reports? The next report, remember we said that we would bring to you a projection of where we were revenues after the first 6 months of the year. So that report you have as well. If you want to pull that report out. It's about like this. It gives you where we are year to date with revenues and where we should be, where we are and where we project to be at the end of the year. A couple of things that I'd point out to you where we're under in those areas in the DSS world for public assistance, income maintenance, those in child support enforcement, those revenues are projected to be under where we budgeted, and that's based purely on expenditures. If you don't spend the money, you don't get the reimbursement from the money. So we're okay. The one area that it presents to us a challenge is in child welfare, where you see that we're projected to be 85% of budgeted revenues. That's a direct result of the 4E challenges that we've spoken about that happened at the state level, with the state and the federal government auditing the state, that the state was not in compliance with 4E regulations. That didn't happen until after the fiscal year began. So that impact really started hitting us in October. So we don't believe that we will not meet all those revenues. We are confident, however, that we will meet our overall revenue targets and stay within the projected net county cost for DSS. In health, we'll see that we're mostly on track where we had some revenues that we've spent greater than we anticipated we would get. That's mainly because of grant revenues that we've received for our breast and cervical cancer control program. We received additional funding. So that's actually means that we were able to fund those services stronger than we had before. In Parks, Recreation, and Recreation, you'll see that we're right on target. Where we've not been able to receive, where we're projected to receive all the money in child care development, and that's related directly to subsidy reimbursement. That's been hit pretty hard at the state level. So we're seeing the feeling the effects. I'm happy to answer any questions that you might have on revenues. Thank you very much.
Thank you. Thank you, Jim, very much. I'll turn it over to Nancy.
Thank you. I'm going to take Hampton's company. County has always had been grateful for the opportunity to work with Tom when he worked at the chamber. And as he moved into the consulting world and away from working directly for the chamber, we found lots of ways to work together. He's very much a resource for the county as we try to define the economic impact of certain industries. He works with us every year on defining what's the economic impact of the hospital system, of the healthcare industry as a whole, our major economic drivers, and those are critical when we go before the bonding agencies to seek our bond rating. So I will share with him, although I won't give him my plaque, our AAA bond rating. We could round it back and forth. But we always ask Tom to come and do an update every year for this board because the work we do. I want to go back and say, last year, Health and Human Services directly touched 123,000 Buncombe County citizens, meaning we provided a direct touchy service. Certainly impacted everybody who lives in the community. When you think about the community-based components and the population-based components of public health and social services, and all of the individuals who take advantage of our recreation facilities and programs. But the economy really drives our business. It really is essential to how we help people and families move towards self-sufficiency. So it's really important for this board to move into the next year understanding what is the state of the economy of Buncombe, and that's what Tom's going to provide for us today.
All right, thank you. How much time do I have, Andy?
I think we talked about like trying to get through it and questions by about one. Is that what?
Yeah, that works fine. For those of you who I haven't met before, let me tell you what I do. I don't do that much work. I used to work for the chamber here for 10 years, 5 full-time and 5 part-time. And then I did consulting part-time for the last almost 4 years. I've been consulting completely on my own. And very little of my work is around here locally anymore. So companies or communities pay me to come in and tell them sort of the unvarnished truth, what's going on in their community. So, for example, I'm working with the mayor's office in Atlanta right now. I'll be presenting to him probably later in March. Up in Arkansas, I'm working at the city of Lynchville. And I work with companies too who are doing some moving. And it's basically, I'm hired to just tell them what the raw numbers say and show what the trends are. I'm not supposed to have an opinion. I don't. You know, I'm not trying to persuade you to do anything, which is probably unusual for most speakers. Usually they sort of have a goal. I don't have a goal. My goal is you've hired me. And I'm going to tell you what I see on the numbers. I'm sort of guessing what I think is important to you. So that being said, you need to raise your hand if it's not on my slide or if you're a little confused and say, hey, what about this? Because it's not all up here. Some of it I know and I have to put down. So we're going to jump right into it. I hope you're comfortable with graphs because graphs keep me honest and they show you some trends. I'm not big on forecast because they're usually not very dependable, but you're going to see some trends and I'll try to point them out, which is going to be real easy for you to forecast off of those trends. So am I okay right here? Okay.
We don't have this on our computer.
We'll get it.
Okay. Just wanted to make sure.
Oh, no, that's okay. And I'm going to stick with Buncombe, except I have a couple slides here that are broader, but then we'll get down to Buncombe. But I think it's important for you to know. You know, the recession started in 2007, and you probably wonder why do people keep talking about it, because that was like 5 years ago. This is a chart that shows change in jobs after the recessions, and I have 1, 2, 3, 4, 5. This current recession is here, and the
line going up to the zero means how many months it takes to get back to where you were when that recession started. So as you can see, we are already 62 months after the recession. We're still not to where we were in 2007. So that's why people are still talking about the recession. We're still, nationwide, we're still 3.1 million jobs less than we were in 2007. So we're not there yet. We haven't got back, and that's why even though 5 years later, people like me are still talking about it because we haven't got back to where we were in 2007. Here's how that looks at Buncombe County. It's a lot more up and down, and I'll tell you why. It's because of every Christmas we hire a whole bunch of people, and then in January we let them all go. We let them all go, and then we've got school in there, and we've got the leaf season, and so we've got this sort of pattern that goes around and around. But right now we're about 4,000 jobs less than we were when the recession started. Now, if we were having this talk a few months ago, I would have told you that we're more like 9,000 jobs. So it's going to change depending on the season. But we're not there. The gray line, by the way, is North Carolina. You can see the pattern. And this is percentage is almost exactly the same. Although Buncombe County has been growing a lot in the last few months. We'll talk about that. So we're about 4% down on jobs. And I'm going to spend a lot of time talking about that gap. Because my guess is you're real interested in your clientele is that gap. Who is that gap? Who are those people that haven't returned back to the workforce? And we're able to really drill down and show you who they are. The Asheville Metro is Buncombe, Haywood, Henderson, and Madison counties. It's sort of an economy into itself, and this is the last non-Buncombe chart. I got a couple more, but that's just total employment. You can see here's the recession, big drop. We lost about 11,800 jobs, 6.6, and then since that time we've sort of stalled. So you're going to see economists say, hey, you know, we're adding jobs, we're coming back, and we are. We just haven't, we're about 4,800 jobs less in the metropolitan area. And then the last one here is just going to show the pace compared to the nation and the state. And as you can see, we're all kind of doing the same thing. And actually, Asheville with Buncombe has actually been increasing faster than the nation and the state for the last 5 or so months. Okay, that's confusing, and I'm going to explain it to you. And tell me if you're not comfortable with it. What we're going to do, the next few slides are, here's the recession started in 2007. That's my zero. So that's zero, and then we're going to say what's happened up until the end of last year between that time. Because we're not going to go back to what things were before the recession. It's going to be a different economy. It's growing differently. Things are happening differently. And I'm going to explain to you what that is. Basically, you understand what this shows? This is the change in the number of jobs. This one's by industry. And I'm going to explain to you what we're seeing here. What's happened year over year. So the first thing you're going to notice, all of you here should notice, the orange line is healthcare. Healthcare has been growing, except for this, has been growing almost for the last 2 decades at a 45-degree angle. This is a 62 job loss in nursing care. Hospitals and ambulatory care have not seen any dip at all. They just kept chugging along throughout the recession. There's 22,000 people employed in healthcare in Buncombe County. It's the largest industry by far right now. And it's continuing to grow, so it's going to continue to be the largest. Now, the other significant industries that have added the most jobs since the recession is you're going to see, and these little bars coincide, retail, lodging and food, that's tourism, and then we have professional services. And then the red would be public administration, which is government, and you can see that's going to be headed into the negative here pretty soon. Going in a different direction. But the thing to pick up here is throughout the early part of the recession, it was all healthcare, healthcare, healthcare. Now some of those other industries are starting to join in. And interestingly enough, in the last few months, our average wage has come down. And the question is, how come our average wage is coming down when we're adding jobs? And my response would be because some of these lower paying industries like retail, and tourism, lodging, food, they're beginning to add jobs again, and so that sort of lowers the average overall. Not necessarily a bad thing, but it's showing the wages come down. But what I want you to take away here is healthcare just so happens that the industry that most of you in, that has been the biggest job producer since the recession and actually before the recession. So who's lost? Well, you probably wouldn't be surprised that construction jobs, almost 40% of construction jobs have been lost, and you might notice that they're still losing jobs. When I talked to you guys last year, it was down, or we thought maybe we could see a turnaround. I don't have any slides on housing, but housing has picked up. You've probably heard housing numbers look pretty good, but not so much that they've added people in construction. Manufacturing's down. Manufacturing there has been down for almost 2 decades, but you'll see this little uptick, and there has been jobs in electrical manufacturing, beverage manufacturing, which is our breweries, interestingly enough, are up over 100 jobs. And I think food manufacturing as well. So that's a little change in direction. Administrative services are temps. They're always sort of at the front of things. And you can see temps, we were adding temps and now we're letting temps go, which I'm not sure what that means. And then educational services, the schools, what's interesting here, you can actually see that's probably, remember the stimulus and the stimulus money towards the schools, but eventually it sort of caught up with schools, and so now we're seeing job losses in schools. Any questions about that? Those are the major trends right now as far as industry and jobs. Now what about gender? And I think I talked about this last time. This, to me, this fascinates me. This recession really hit genders differently. And I'll explain to you why. It's pretty obvious when you look at it. You can see that we're about 13% down for males, almost 9,000, and 6,698, 9% for females. So the male population was more directly impacted, and they haven't come back to the workforce yet. Remember the gap here, the gap here would be since the recession, sort of the ghost unemployment. They're not here. We don't know where they're at. By the way, I don't mention unemployment at all in my slides because unemployment is a phone survey, and they probably call a couple people in Buncombe County, and then they extrapolate all of that. So it's really not very valid most of the time. So here's why that last slide, remember this.
Can I ask a question?
Sure, please.
So that zero on the slide before, that represents what the employment numbers were back in 2007. So were men and women equally employed at that point?
We'll get there. Okay. No, this is just, I'm eating, it's zero for both of us. It's a good question. Okay, so here's the main reason. Remember the industries that are gaining are healthcare, and the ones that lost were construction. So lo and behold, 78% of the employment of healthcare is women, only 22% male, and you can look at construction, 80% male and 20% female. By the way, I did look at 2012, and the percentages haven't changed at all. So that's why, it's industry specific, this recession, and construction, those sort of industries, heavily male industries, and healthcare has continued to grow. I did a study probably about 4 years ago, maybe 5 years ago. It was really fascinating. Someone said, where's the loss of the middle class? Remember there was the whole thing of the loss of the middle class, and it's still sort of coming up. And they said, can you tell us what's gone on in the Asheville Metro? And I said, well, I can just look at who's making money, the main earners over periods of time. So we can do it by age, or we can do it by gender, and all that kind of stuff. And the bottom line was, if you look back maybe 10, 15 years ago, and you're all going to know this, but you had a lot of males in manufacturing, and they were sort of the core of the middle income. Fast forward 10, 15 years, you have females in healthcare in the core of the higher wage middle income. So a big change there, probably a big change in a lot of families as well. And this demonstrates that. This is sort of what you got back to. This is just the raw numbers. And so you can see in 1992, there was actually more males employed in Buncombe County than there were females. And this is one of those slides where you can figure out what's going to happen next year, right? There's going to be more females than males. And it just seems to be widening. And, outside of the industries that employ those males or females, it's very interesting because even our population overall is becoming more females, especially a lot of, and we'll talk about it, people moving in, baby boomers, and so you're going to get a bias towards females because females live longer. So anyway, this is our workforce and becoming more female and less male. Although you can see there's a dip up in both groups there. Now we're going to do by race. I thought this was fascinating as well. The workforce is 87% white alone. So it's not very diverse to begin with, but we're doing the same thing. We're looking and we're saying, okay, absolute numbers. What was the change for Black African American? There was a 15% decline in their total employment, whereas white alone there was a 10%. So a bit of a difference there in job loss. I took a look because I thought it'd be interesting. What's the difference on race and industry? And there's not that big a difference. I think if you look at those two sectors, we looked at healthcare and construction. Construction is 5% Black African American. Healthcare is 10% Black African American. So that doesn't really help prove this numbers out, but there is a difference within industries. Now you see those 4 little tiny lines up there. I'm going to expand on those. Those ethnic groups. I think the most interesting probably is the blue line up there that's American Indian. I doubt if we had much Alaska Native, but they were the hardest in percentage terms. 19% lost employment, and we have 18, more than one race. None of these are very large. These are like 1 to 2% of our total workforce overall. But you can see that they were, based on our last slide, with 87%. 10% reduction in employment. Most of these are overall higher. So non-whites have been impacted more in the recession.
Excuse me.
Yeah.
So, here's Hispanics very next.
Oh yeah, here we go. So here's Hispanics. Hispanics are 5% of our workforce, I believe. And you can see 50% loss. Non-Hispanic is 11%. And here there is a considerable difference when I look back at our benchmark industries, when we look at healthcare and construction. Construction employment is 12% Hispanic, and it's only 3% Hispanic in healthcare. So this is another group that was impacted by the type of recession that we had. And this is by education. I'll make sense of this for you, but we've got 4 different main groups of degree of educational attainment, meaning the highest level that you've reached. About a third of our workforce have high school degrees, and about a third have some college or associate's degrees. And when you look at percentage losses, actually 8.2% high school degrees, those with high school degrees will impact the greatest. Can't really explain why that is. And as you can see, probably unsurprisingly, those with bachelor's degrees were less impacted, only 4.6%. It always fascinates me. We still have, I can't remember the exact numbers, but it's pretty considerable, the number of people in the workforce that have less than a high school degree, and they're employed and they're being hired back, so they haven't disappeared, they're still here. Here's by age. This is a fascinating one. This is where probably Buncombe County is a little bit more unusual. 2 things to point out, very important. Ages 14 through 24, 30% have disappeared. Huge impact on that group, down 7,000. Now, look at the other end of the spectrum. Those ages 55 and 64 and 65 plus, there are more employed now than there were at the recession. So more older folks in the job labor force now than before the recession, and continuing losses in those ages 14 through 24. And let me show you what that looks like over the last, since 1992. And here's what's important, right there. And you can see the huge impact that the recession had on the 14 through 24s. And you can see those 55, those baby boomers just keep coming on. And this is another one of those trends where I'll bet you we can figure out what's going to happen in the next few years. More and more baby boomers in the workforce. And I would hope to say that we're going to see the 14 through 24s come back, but we haven't, and it continues to
This board deals a lot with retirees who are not in the workforce, but this doesn't reflect that particular process, and I can see why.
Yeah, no, this is just workforce.
That's a big group of people in this county, in this area.
And I've got the last few slides, it's going to be a bigger group. Any questions as I go along here? We have a lot of free time, so we don't have questions.
Well, Tom, is that the same for, have you looked at that national?
This database actually is not available nationally, so no, I don't.
Well, I mean, I'm just curious, the 14 to 24, the problem with that is that they're not getting the experience they need to build a resume then, so that they can get into jobs.
I think, yeah, one of the concerns here is these folks are learning the sort of introductory jobs. How do you show up on time? How do you get at a fast food or something, and then you would transition that. So the other side of that, I've heard people say, well, maybe they're just staying in school longer. And probably some are as well. But it is concerning to me that you've got a group that should be learning about going to work and being part of the workforce, and they're just dropping out. Now, I also should say I've got a 21-year-old and a 23-year-old of my own, and they're both going to school, but usually they have part-time jobs and they're unable to find, at least they tell me, they're unable to find jobs. So, it is harder to find jobs than it is right now. I was telling them to blame the baby boomers. Poverty rates, I think I might have brought this up last time, and I think after I did my presentation, the paper said, was that the highest poverty rate we ever had? And I didn't, we were, it is. So it's continued. If we were here, this is where we're at now. It's about 40,000+ people that are officially in poverty in Buncombe County. That's probably the most shocking slide you're going to see. And you can also see how long it's going to take to get back to where we were back in the early or the late 90s. So you can also see directly, here's the recession right here that just jumped up after the recession.
But it's not turned around either. I mean,
There's no turnaround.
going up.
Yeah, there's no turnaround at all there.
And how do you define poverty?
This is the census does this, and it's very technical actually. It's income by the size of the family. So I think there's 7 or 8 different categories. And I'll be the first one to say these numbers are estimates, number one, and they're political, so they're always fudging with those numbers. In fact, a lot of government programs are not counted in what's considered poverty. So food stamps are not included. So you could get more of your income as food stamps, but it's not going to show up.
What's the difference between the bars and the circles?
Oh, that's a good question. I'm sorry. The bars are the absolute numbers, and that would go to the side. And then the little dots are the percentage. That's a good question. I'm sorry. I should have said that.
Tom, I had heard at one time, and this may be a slide that's coming up, that maybe 50% of African Americans in Buncombe County are at or below poverty level.
That's a good question. I don't know. I don't know. This database doesn't have that. But I'll look. Yeah. Usually when you get down to the county level, there's not a lot of depth. I'm sure at the national level it's pretty good. And I think if any of you read, Randy Hammer got some numbers from me on school numbers by school districts. And I can't remember what the numbers were, but they were pretty dramatic, I think, in Nashville City schools. Certain age groups, the increase in poverty rates was skyrocketing.
How much will that impact the commerce tier rankings?
Oh, no, relative to other counties? No. And actually, which would be another presentation, Buncombe County, relative to a lot of the other counties, is doing quite well. We're sort of looking at our own navel here introspectively, but we're doing well. We usually have some of the lowest unemployment rates, we're growing faster. So, compared to other counties in the state, we're doing pretty good. Here's the poverty rate relative to the nation and the state. And so you can see that this is probably the first time, I think we just about met with the state here. We met a little bit lower, right about with the state. First time that we've been above the state and the nation, maybe ever. The numbers aren't very good when you look back and forth. Okay, someone talked about the population This is important to know. This is Buncombe County. There's 3 sources of population growth. You can grow your own. You know, you have births over deaths. That's the natural. Domestic is people moving in from the U.S. And international is people moving in from overseas. So first of all, you should notice that overseas and natural really haven't changed a whole lot year over year. I did this presentation in Buncombe County. In Haywood County. In Haywood County, they have no natural. Like it's a negative year. So their overall population in the last 2 years has declined. So they're on sort of that slippery slope. Buncombe County, I looked over the last 40 years, we've never had a year where we've lost population. It's grown every year. It's healthy. What we want to talk about, the people that we're all interested in are here, and that's those folks that are moving into the area, and that's what keeps the area growing. It's responsible for like 80% of the growth of Buncombe County over the last 40 years. And after the recession, you can see the recession here, after it hit, this is all about people moving in, buying those homes, those big homes. And I was very concerned here that we might see some negative, but people are still moving in. So that's the best news that we could have heard after a recession that was all about housing. And our economy was largely driven by housing and those folks moving in. It's probably different people, but they're still coming in. And so that's very positive. As I said, in Haywood County, they've left. They're not coming back, and they do come back in a while.
Does that international include undocumented workers?
Yep, I hear that question all the time. It should, yes. Yeah, this database doesn't discriminate against that at all. That's a good question. But you can see it's never been a big, it's about the same year over year. And here's the population growth rates, and so we're down to just over 1%, but you can see we've sort of leveled off. We're above the nation, as we always are. And then you're there, and you can see we're just a hair above North Carolina as well. If you go back 40 years, our average growth rate is 1.1%.
On the slide previous, does that, did the graph represent a lower increase in Buncombe County residents? Does that represent an exodus of Buncombe County residents?
This is net. So exodus will be, and this is what's left over. After you come and you go, what's left?
But trying to figure out is the net migration of Buncombe County residents that would be younger folks that would stay for employment, and the in-migration would be those in the older category.
And I'll get a little more, I know what you're saying, and I wish I had numbers to show you. I have one slide here, we're coming up on a slide that I think sort of helps explains that. And the question always is, and I used to have a slide that would, if I get you right, you sort of, the 2 groups that would drive in-migration major were baby boomers, sort of the Floridians, and then there was the young interstate, the 20-ish people that wanted to come here because they go to college here, it's a cool place to be, and those were sort of the two main groups. This area really doesn't attract, and you know why, that would be a lot of young families who are looking to, break out and make a lot of money and go ahead. And so what you would see, and I'll show you one slide that kind of have to close one eye. You sort of see a little dip. You see the 20-ish coming in here, and then you see a dip in the family age, and then you see it coming back up on the older group. And that never changes too much. So the perception is, they come here as a youngster, cool, neat place. You know what, I could just move to Charlotte if I have a family, and then I could make a lot more. But the baby boomers, that's not really much of an issue. But that's a little bit of an extrapolation. So here's those growth rates. And then we're going to switch gears a little bit. We're going to look at wages and income because this is pretty significant. I don't know if you know this, but Buncombe County wages, average wages relative to the state and the nation are lower, like 20 to 30% less. I remember when I had first started with the chamber, David Young was on the board, and he said, what would it take for us to get our wages up into the top 5% in the state amongst all the other counties. And so I have an economic impact model. I just started moving in. What if we moved in a manufacturing plant? What if we moved in a huge company doing this or that? And I remember calling David saying, you'd have to literally move Microsoft to Buncombe County before you get into that top range. It takes a lot to move the average of everyone's wage. And there's a lot of factors. It's, the history, it's what we produce, it's educational levels, it's the demographics, it all kind of goes together.
How much do that, one of the things when we were preparing for bond rating, we noticed that is we didn't have the same impact that a community like Metro Bergen had that was so banking, that grew in one area and the area crashed.
Well, and that one benefit we have in this area, remember I said healthcare, number one, is the big grower, and we really haven't seen any declines there. Then the other areas were manufacturing, good wages, declines, but sort of a different kind of manufacturing. Tourism has always stayed pretty steady. And then construction was off and on, it's down now. Anyway, we have like 3 or 4 different legs to the stool that are different. And so when economies are really burning up and doing great, you usually get the Mecklenburg or somebody that they're focused on one industry that's doing really well. But then when the bottom falls out, that's all they've got. So, we didn't plan it that way, but we've got a pretty diversified economy. We've got different industries that really don't have much to do with each other. The manufacturing group really doesn't have anything to do with tourism, and healthcare doesn't have a lot to do with manufacturing. And so they're all sort of separate wheels spinning along. For a long time, in economic development, it was always, well, we're going to get that, we need another leg to that stool, and it was thought that the professional business services, and you may recall that was an earlier slide, it's only a few, gosh, I can't remember the absolute number, it's less than 10,000, but it's, it's designers, people that work on computers, designers, architects, lawyers, any sort of computer work, that's professional business services, and that's always thought that would be the fit for this place because the way downtown is and small businesses and all.
How do you account for the large number of people who come to Buncombe County to work and who don't live here?
Yeah, and that's counted up, by the way, in these numbers here too. And I can't remember the numbers.
39,000.
The 39,000? Yeah.
They'll tell you I never forget.
Yeah, I forget.
They tell you what, man?
I said I'm speaking with the mayor of Atlanta, his team next month, and I can't remember the exact numbers, but it's like 8 times as many people actually work in the city of Atlanta than live there. And some of the people that live there don't work there. But I've never seen the gap so wide. But you're right, and most of these numbers, the next slide of it is the only one that has just Buncombe County, but there's a tremendous amount of people driving in and out all the time, and you don't know.
I think there's a larger number who drive into work
than
drive out to work.
That's the 39,000 a day who come into work.
Yeah.
The whole idea behind the Asheville Metro, a metro area is a urban core surrounded by some suburban or rural. So we are at the epicenter of the urban core here. And then people come in from Haywood County or Madison and Henderson come into the urban core.
When we looked at how that works in the urban counties, one of the things that really hit us is Buncombe's not touched by another urban. We're the only urban in the West, but if you look at the other, what the state calls the Big Ten, the other 9, they have some close proximity to another urban. And while you're transitioning slides, welcome to Commissioner Joe Belcher. Welcome to come up to the table and join us. We're glad to have you.
So Tom, are those wages per job or per person living in Buncombe County?
Per job.
So if people were commuting in, it's the wages they get coming in here. And then was the median different from the average on that?
They don't publish a median for this data.
Who is the they you keep talking about?
Oh, well, it's different for each slide. This is the Bureau of Economic Analysis.
Who are they?
They're the folks that do the GDP for the nation. There's really 3 main agencies. There's the Census Bureau, you've all heard of, right? Yeah. And then there's the Bureau of Labor Statistics. Yeah. And then there's the BEA. And you don't probably know that. But they do, they actually take the data from the other 2 agencies and compile it to the third. So they do exports, imports, GDP, sort of the higher level stuff. And their stuff, they don't use any estimates. they'll look at the tax code. Yeah. It's a good question. So the question here is, okay, we know we're a bit lower, but I mean, we have been that way for a long time. We're not the lowest. But what's the change been over time? And here's where it's a little worrisome here. I just zeroed out, took out inflation, and we're zero in 2001 over the last 10 years. And we're actually only $66 above where we were 10 years ago. So, you hear about the flat wages there. That's what's happening here. It has not been much overall. Industries, yes, but overall, pretty much flat line. This is not unusual. Like I tell you, I do dozens of communities. I've done dozens of communities where it's negative. It's the first time they're ever going to see it because you usually don't get the opportunity to zero out and take all the inflation out. So a little depressing. And then per capita income is another animal. Per capita income does measure just the people who live in Buncombe County. So this is just those who live in Buncombe County. And we're going to dissect this. There's something that's going on here that has caused, when I do presentations to other communities, I get to this one set of slides and they all go, oh my gosh. So I'll let you do that too. Because it's sort of something we stumbled upon. So there's the change, and here we do have a negative change. We're actually about $500 less. Now the next slide is going to tell you what's in per capita income. Per capita income is all sources of income, not just wages and earnings. So what that would be the main things are earnings, wages, investment incomes, dividends, rents, and then something called personal government transfers, which are services, your benefits that you haven't done anything for. And we're going to talk a bit about that. This can be Social Security, income maintenance, Medicare, Medicaid, that sort of thing. So right here you can see the slide that we're down about only 55% of our net income is from wages, and that's slid down. We're at 23% from the government transfers. I'm going to report now on the 366 metros in the nation because this isn't a unique happening here. And I think it's 77 metros have 25% or more of their income coming in as a government transfer. And if you look just like 5 years previous, it was only 9. So it's a real trend that's happening. And you guys are going to be the front line of that when you see what's behind that if you haven't already guessed. Here there's our, over the last 10 years, I've zeroed it out. This is without inflation. You can see that personal government transfers, that's where the growth has been. Now, earnings still, remember, make up 55% of the total. But here's the change. So earnings have not done a whole lot. But the real change has been that personal government transfers. So what are they? Well, they break out into 3 major groups: medical benefits, Medicare, Medicaid, retirement disability, that's Social Security, and then income maintenance benefits, which is SNAP and those sort of family relief programs, which have just really jumped up just since the recession, which you sort of expected. But I thought you'd be interested. Those medical benefits are just going nuts here lately. And actually, I went into the CBO's website, the Congressional Budget Office. Those poor guys, they pull up in front of Congress all the time and they beat them because they do the projections. Now, this is a national projection, but according to them, they would say that medical benefits over the next 5 years will increase by about 50%, retirement will increase by 30%, and the income maintenance will actually decline by about 1% in the next 5 years because the recession hopefully will be over, so some of that will decline. But the other two are going to be shooting off here nationwide and here locally as well. So
do you see that as a trend that incline is steeper in communities where healthcare is the economic machine? It benefits your healthcare providers in the long term if the medical benefits are placed.
yeah, well, I didn't talk about that. My next slide, which is my last, it talks about population, and I think it has to do a lot with population. But see what you're saying as well.
I know that hospitals, especially now, put a lot more resources in terms of identifying folks when they come into the organization that, if they don't have a benefit they're eligible for, they absolutely try to rally to help that person, obtain that benefit. So it's just
I think that's interesting.
consider.
It'd be the same issue as saying, SNAP's and income maintenance. Food and nutrition brings in $59 million a year pure government, federal money into the local economy that fits into grocery stores and retailers. Flips the other way.
And are those medical benefits public and private?
Well, I don't know. It's from the federal government through those programs. Now, I don't know how those programs are. You would know better than me how the programs actually dollars into the community.
I think
They're all public?
That's all public.
That's all public?
If my memory's right, that last year they said 22% of the national gross income of assistance, so 20% of people's earnings in the United States came from public government assistance. So that kind of tracks.
Right.
Tom,
Yeah.
of that growth, we talk about public benefits and systems we work with. How much of that is attributed maybe getting Social Security, getting Medicare now?
Yeah, absolutely. I don't have a number specifically, but I have some population numbers that show that you're absolutely right. I mean, obviously Social Security, that's all, it's the most part about age. Yeah.
Is the medical benefit based on the true cost of procedures that people are getting? Because when you talk about having private health insurance, you're still getting, when you come in and use your insurance, you're still getting some sort of supplement from the private side. Is it just talking about, because it kind of seems, if you have private insurance, you're still getting some sort of benefit from that, but you're judging your public benefit by the cost.
That's a great idea. I'm sure this is just going to be the public dollars.
Yeah. That is a good point.
That's a very good point. Good, you're thinking about this. So, based on what you were just talking about, there's this, I'm going to switch over to age profile. And what we're looking at here is just the number of people by, and I made it into a line, number of people by age. So as you can sort of see, there's those baby boomers. And here's that other younger group, that 20s group we were talking about earlier that comes in here, and then here's that little bit of a hole here and here where there'll be the families. So that's where we are in 2012, and then the state does a pretty good projection actually by population. Here's where they say in 10 years where we're going to be. And so you can see one thing, everything just sort of moves over, obviously. But you can see they think there's going to be an increase in this age group, the 30s, and then a big increase here. The next slide will show you that. So there's the net change. And this would say that 50% of the net change in population is ages 65 and older. So let's go back to those Social Security numbers. It's only going to get bigger. That group, they're more employed, more in the population, and more growth. So if you have a service or a product for a person 65 or older, this is your time. Your place. Beer. And this group here too has increased. It's increased as well. Actually, I'll tell you. It's projected to increase about 10,000 jobs, 11%, and the 65 and older are going to increase by about 17,000. So big increase in that area. So for those of you that weren't individuals, I have three slides that summarizes what I thought was important. We're growing. The recession is over, and we are growing. We're growing population-wise, and we're growing job-wise. The recession ended. I should have changed that. It's more like 5 years ago. 5 years ago, and we've still got a ways to go. If you look at those charts and look at the direction, and we haven't made up the difference, if you get your calculator out, if you did sort of a basic forecast, it would say that in a year and a half or 2 years, we'd be back to where we were in 2007. But remember, we've also added people since that time. So it's going to take probably 8 years, probably 8 or 9 years to get back to where we were, to get everybody employed at the same rate we were in 2007. The leading industries are healthcare, you guys. retail, tourism, lodging, third, and to a smaller degree, and one that people are very excited about is this professional and technical services. The hardest hit were construction, manufacturing, administrative services, those are temps. Young workers, remember those 14 through 24 have been devastated. Men to a greater extent than women. Non-whites, they're again greater extent than whites. And then for some crazy reason, the high school educated versus those other areas of education. Poverty is at an historic high. With population's growth, but it's a slower pace, and that's probably going to be, I don't see anything on the horizon that's going to change that. Probably the rest of our professional career will have a pretty stable population growth. Wages and income are stagnant, and these government transfers are expanding rapidly. And then 1/2 of the future growth will be those 65 and over. So, more questions? Or put you to sleep? Anything that doesn't match what you think is going on?
I just didn't like the one that shows it overly going down this way.
Yeah, I know.
It's going down like
I kind of saw myself out there too. It's not what I expected. Me too. Yeah, we're already there, sorry.
Well, I had thought I had heard that middle-aged and older workers were hit harder by the recession than younger workers, but clearly that's
Not there. No. And those are real, pretty good data there. And I think nationally some of that might be true. You know, I should have probably said that one of my things I always tell people is economics is really a local phenomenon, and so you've got to be really careful when, you know, you look at a lot of the national numbers, they're just huge, gross aggregations of a lot of stuff that's happening locally. And this presentation is not going to be the same one I'm going to give in Atlanta, it's not going to be the same one I'm giving in Arkansas. They all have different moving parts and different populations, groups, different things happening. So you got to be careful when you turn on the TV or open the newspaper when there's something that's happening, because there's nothing that happens everywhere the same. It's all unique and special.
When you send us copies, is it possible, and I know that may be an adjustment to our service contract, but to add the housing components?
Yeah.
I do think that's a real, I mean, that's really significant to us in how we plan around health.
Yeah, well, I apologize because I have the information. As I recall, building permits for single-family homes are back at the level, almost to the level we were at pre-recession. Now, so you've got to remember there's a huge gap, so it's sort of catching up to where there was a loss. And of course, when you look at the value of the permits, they're less than they were before because the kind of homes has changed. And there's a lot of inventory in that 1 million over, but supposedly that's getting whittled away as well. But I've also put a slide in that puts the sources for all this.
Have you seen a change in agriculture-based economics, agriculture to the agriculture?
No, I mean, agriculture is measured differently because their employees are picked up differently. So they only do it every so many years. So no, I mean, when you look at the farmers, not large numbers. I mean, it's usually not a very large number of people. What we have usually is we have part-time farmers, full-time farmers.
Yeah, I guess I think of that more in non-traditional farming, agriculture.
Yeah. Yeah, and there's just not a lot of data that the USDA has that, and they count mostly full-time farmers. Now, where you do see it, maybe sort of the other end of it, is like I said, food manufacturing has picked up, and there's a lot of little niche food manufacturing that might be sort of the area that you're talking about.
Thank you so much.
Thank you, too.
The economy is very important to this whole, because as the economy goes, our issues change, as we found that this year with all the various things that we're doing or going, because people who don't normally look for our service are having to utilize services that we have in health and human services. So that's one of the reasons why it's important that we listen to a report like this, so we get an idea about what it looks like, where it's going. Hopefully it will continue to go up. Again, thank you, Tom, so much. Thank you. Any questions or any observations? Okay, then we need to move on, and that we need to go into operating procedures. Remember, we went over them last time, so hopefully it won't take as long as we did with the Board of Commissioners, but anyway, since we have two up here.
That's true. I mean, but there's two ways we can do it, and I prefer the easy way, so let's try that. You know, that this board was officially formed and integrated back in September, and since that time, we're getting together once a month and getting feet wet, and nothing contentious has happened. But that won't always be the case. At some point, we'll have a situation where this whole board won't agree, and that's where the rules will come into play. So we just have this set of operating procedures, and just generally going through it quickly, we have a chair, we have a secretary, Mandy's secretary by reason of her position on the Health and Human Services Board director, or it's rather the Health and Human Services. We have various standing committees, and those forms and functions are set out, and exactly what those standing committees are doing or how, I mean, we have to check with Jim or Mandy to see it more in particular. The procedural rules for motions and whatnot is what the purpose of the rules are for the most part. And I know we had some discussion about this in the past. Special meetings, if there's ever a need, the chair or 3 members of the board can call a special meeting. If there ever is a special meeting, then only the topic of the special meeting can be discussed, unless you have all 18 members right now, and we have a full board of 19 members, you'd have to have everybody present. If you had every member present and accounted for, you could go into other normal business of the board. But typically, special meetings is just for the purpose of that special meeting. Agenda items are done and put together by Mandy in her position as the secretary, and that's her job. If there's any group or any 2 or 3 or 4 of you or any one of you have any item that you think ought to be on the agenda, then the proper process would be just to go to Mandy, tell her what you're thinking, how you think it ought to be done. And lots of times, just from experience with the commissioners, if they go to the county manager, it's similar to go to Mandy in your position. Sometimes there's really not an issue that needs to come forward and it gets resolved. Sometimes there is, because lots of times the bright idea comes out of that. So that's the way the agenda items would be put together. Quorum is going to be a majority of the board. We're going to have 19 at some point, so that'll be 10 members. Right now we have 18. It'd still be 10 right now since we have 18. If the quorum is not present, then you can't conduct business. The rules as drafted do allow a member, if Commissioner King was on business somewhere and couldn't be present, he could call in and have his voice heard at the hearing. But if he were visiting by phone and that made the quorum, then the quorum would not be present, because you have to have a quorum of people physically present to conduct business. I'll pick on Commissioner King again. That just brings it to one point together on the quorum. If we have a particular divisive item on the agenda, and Commissioner King, as a member of this board, says this is the craziest thing I've ever heard, I'm not going to be a part of it, and I'm not going to have this vote, so he gets it and leaves. If that were to happen, that does not change the quorum numbers as they currently exist, and when the vote came, his vote would count in the affirmative for the motion as made. So be careful.
So stay in your seat.
Yeah, you may not like it, but just grin and bear it and stay in your seat.
And at the same time, if he does something like that, he doesn't speak for the full board.
That's correct. He does not. That's he's speaking for himself. Anyone would do. The chair, by reason of being the chair, has a few powers, mostly just to preside over the meeting, to rule motions in or out of order, to make sure that the speaker maintains decorum, and to call a brief recess if necessary. When the board action is occurring, Bill has pointed this out at the beginning of this board's meeting back in October, I think, or into September. We generally follow Robert's Rules of Orders. The reason I worked with Mandy to redraft rules was not simply because I'm lazy, because sometimes I am, but just because it helps to have one set of rules for each board that the county has. So the rules we have now before us are modified Robert's rules, because Robert's rules is a whole book, and it's usually meant for a very large body, like the size of Congress, a lot of members. This is 19 members. It seems like a lot, but it's not that many. So the rules is the short form rules, A through R, for procedural motions such as deferring consideration, amending, reviving, setting off, or deferring for a particular number of days. If a majority of the board, for instance, did not want to follow the rules or wanted to change the rules, you could do so by a majority vote at that time, but that change would only take effect for that one particular meeting unless you change the whole rules officially. So if you wanted to change the rules and say, this doesn't provide for tabling a motion, but I think today we ought to change the rules to be able to table a particular matter. You can do that, but come the next meeting, that temporary change would disappear.
Ms. Brooks, since we are a arm of the Board of Commissioners, we're following their particular procedures and so forth. And that's why it's important that if we were to change something now, it wouldn't be a continuous thing, but we are still following what the Board of Commissioners have.
Yes, yes. And what we don't have, some people may notice, what we don't have in this set of rules that the commissioners have in their rules, mostly because the public needs to see, needs more often to see what the commissioner rules are. For instance, we don't have rules in here regarding public comment. But, there's general statutes that cover how public comment will occur, and so they don't need to strictly be reiterated, because the same generally would apply that public comment, you have to have one a month, and the chair as presiding officer can just sort of set the general rules for public comment. I know the general is just 3 minutes, and for public comment, to comment about whatever this board has general authority over. So there's no real reason in this venue to reiterate what those rules are. So if there's any questions, I'd be happy to try to answer them. Very good. Thanks.
All of this is very important that we do have procedures to follow. And since they're modified, we follow the order. I'll give them a lot through. But anyway, I think it's important, if I'm not wrong, we need to approve these at a board or just accept it.
I would go ahead and just do a motion.
Okay. So moved. Okay. I have a motion. I have a second.
Second.
Moved second. Any discussion? All those in favor say aye. Aye. Opposed, same sign. Passes. Thank you very much.
Sure.
Mandy,
The director's report, Lisa's actually going to give a brief summary of work she's doing on consumer advising. We're really aware that since the board got formed in September, we've been focused on orientation, and y'all really get to work, and we know that we're just getting talked to. So that Bill's going to talk a little bit more about how we're going to change the format starting next month to do a little bit more of that. It is a very large organization with a very large scope defined in federal and state law, and we have some requirements to do the orientation. So bear with us. We're closely wrapping that up and get to the meat of the work we do every day, and to engage with this board to moving us forward. This is going to talk some about the consumer work that she's doing for consumer advisory committee. I think you have a couple of board members sitting on that.
Terry Van Dyne and Frank are both on that committee, have agreed to work with me on that committee. We actually just met for the first time. But this is, oftentimes the consumer aspect of an organization is the loop that can get dropped because you're so busy providing services and doing things that it's oftentimes hard to have staff and efforts expended toward following up on that loop and making sure that what you're doing is being delivered in a way that's friendly to consumers. It's also being delivered in a way that makes a difference in people's lives. And so, I don't know if you remember back to the first board meeting, but we kind of talked about that single pregnant young female that's in the community and what does it mean to each of us for that individual to succeed? What does it mean for that individual personally, but what does it mean for us as a community for that person to succeed? safety. And the Consumer Advisory Committee, what we really want to use that committee for is to get that insight from people in our community about what they need in the way of supports so that choices within their reach, good choices are within their reach. So if they want to make good choices about their health or their safety or their economic stability, then what is it that they need in order for us to support them with those kinds of choices? And we can't do that unless we're hearing from people who are actually experiencing that. So one of the things we wanted to ask each of you as board members is, if you are aware of somebody within the community that you've worked with that has a personal experience, a life experience, or a perspective that you think would help inform that work in a way that would allow us to really get that kind of ongoing dialogue with communities and neighborhoods and different ethnic and racial groups within our communities, we want those people on our committee. So Frank, again, and Terry both are on that committee working, so you can provide them with those names or provide me as well. Does anybody have any questions about that? We hope this committee will touch everybody's committees, that this work will help inform everything that we're doing. The other thing that we're doing along with this committee is that Mandy's senior leadership team has been meeting, because parallel to the work of the board is work that we're doing with the senior leadership team and how we're moving forward, kind of like in this new stage of combining health and human services. And so another aspect of that that's very much in tandem with this is the communications team that we're developing. Because again, it's how do we develop a vision for this community around health and human services that engages people in a way toward action, right? So the communications committee will be working again with that advisory committee, but along those lines as we're looking at many different ways to get feedback from consumers. And I just wanted to share with you, we've been doing some little PDSAs, little small pilots to figure out how we can get feedback. And Eddie Shook and Ben Atkins and Meredith Green and Amy Davis and a number of people of us have been meeting, and we've come up with 5 very simple questions that we've been asking, along with branding and everything else. But we did a pilot the other day and we got responses back, and of the 44 responses back we got that day, we didn't have a single negative response. And we just simply asked one question at the bottom of this ticket that a consumer pulls when they come in: were you treated with kindness today? And next week it will be, were you treated fairly? And the next week it'll be a different question, so we'll kind of be able to get an ongoing rolling assessment of how things were. But it's a great system because we can pull, if somebody says something negative, we can then pull that ticket and figure out what service they got, who touched them, and we can do good follow-up to make sure that we, again, are providing the kind of service that we want to, and we're modeling for the community what it means to provide compassionate service in a way that consumers are supported in their efforts toward health and safety. So I was just going to randomly pass these out, but I mean, it was just really good to see that people, took the time. We kept it really simple. I was just meeting with a student from Warren Wilson, and I was telling her that we try and do things that double down and reinforce everything that we do. So even this is a way of telling people that they can vote, that what they do matters, so that ticket, when they leave, they actually put it in a box, which is like a ballot box, and it shows them that they can have input into a system that's directly affecting them. So again, it's just another way of reinforcing the message. So that's all I have. Oh, and one last thing is on April 25th, you've got a notice in your packet that we're hosting the county, the city of Asheville, and UNCA are sponsoring a conference on realizing the benefits of diversity and inclusion in the workforce. And that will be held at the Wilma Sherrill Center at UNCA. We think we can hold about 175 people. Robert Livingston is coming back to speak as a keynote for that event. I don't know if any of you on the board, I know some of you heard him before. I know Don was one of those individuals as well as Sharon. But very dynamic speaker, provides very interesting and compelling research. So he'll be here on April 25th. Mandy will be speaking at a luncheon panel about work that we've been doing within the county as a lead anchor institution around these issues. And then we're going to have this really fun kind of speed dating process where it's not really speed dating, but it's you're going to miss it, Don. We're actually doing these microburst sessions where we'll have 25 sessions available, and we're doing it around the circular rotunda in the conference center. where you can go and have a small group, 10 people or less, and learn a particular skill or a certain resource that you might use within your agency that supports a diverse and inclusive workforce. So you might go and find at one station that there's 5 accountability measures that every agency should have that helps drive inclusive and innovative workforce. You might go to another one and find out about particular training that if implemented does a lot to bring better awareness and understanding within your agency. So we think it's going to be an exciting day, and we hope that you guys will come. And if you're interested in attending, please either contact me or reach to me.
No, just to say that we clearly would cover your registration. I mean, we considered Health and Human Services Board a part of the organization when we did the plan. So just if you do your registration. You might not notice that you don't get paid. I think you did here. So anything will help you with your That's it.
Next, we have a public comment. I don't see him behind the camera, but I know he's here. Do you have anything you'd like to say? Yeah, can I stand here? You can come up here where we can get a better picture of you.
No picture, Jerry, no picture.
They're still working on the sound.
I'm still on the milk carton, so everybody knows. Thank you very much. One of the things that I saw here on the slide that kind of bothers me is the big red mark where it says healthcare is going to be the big industry. We don't know what the feds are going to do. We really don't know what the state's going to do. And I think looking at the picture of that and thinking about the number of population that people are getting older, I'm not getting older yet. I'm going to live to be 100, so you don't have to worry about me. So when you look at the older population, then you look at the industry, you look at the young people, that families like mine, my 3 grandchildren are already out of state. They're going to college, they're engineer and another's going to be something else, and they're not going to be coming back here. We're educating people for other states. And when you look at the dynamics of young children, we're going to become the old community in Buncombe County because we don't have anything for young people to be drawn here for jobs. And to me, it's concerning that we have a health industry and we're going to be looking at that as a job market, but it's going to be taking care of old people as we see them in the community that we're looking at now. So when we see the industry flip, I think that we are looking at something more than 7 or 8, 10 years down the road that the gentleman referred to. I think we're looking at something far different than what he has got on his radar, because I don't think we're going to have a plan of action to take care of what we're coming for. Because Buncombe County has got to have tax money to pay the bill. And if we become a healthcare industry, that's not going to happen. People ain't going to have the money to pay the bill. That's good. Thank you.
Thanks, Gary. Interesting viewpoint. Does anybody have anything they'd like to say? One thing while you're trying to think about it, we have been concerned by the fact that we have to do the orientation, and it's important that we have the legal part of it and the financial part of it, and also listen to the economy. And so the staff has been involved with how can we better get information from each of you as to what we need to do and so forth, what you would like to see happen, because it's going to be very important what we're doing. So at the next meeting, we're going to split ourselves up into groups, and we're going to meet various places throughout this building, except we won't get involved with the bank. We'll at least be in various places. And the staff is setting up a program to provide. We will get input from each of the board members. We'll also have a chance to interact with the staff and to start setting up processes that we need to do for this big board. I look forward to it. I know in the past we've had meetings, we split the various board efforts. We were a smaller integrated board, and it worked very well. And I think that for those of us on the board, it would be good to hear the staff react today. They are involved people, and they know what they're doing, and they're very good at what they do. So next month, hopefully it won't snow, but we will have an opportunity to break up, and I'm assuming we're still going to come together at the end. Yes. We're going to come together at the end and listen to the various reports and so forth. And we'll start doing that so that we'll start getting ourselves more involved in what we're about. Anybody have any question or anything you would like to add? One way or another?
This is unrelated.
Well, I don't want to hear it. Go ahead. No, go ahead, Don.
I just wanted to commend Krista for her diligence in getting this meeting set up. And when I walk in, my computer is here, everything's on it, and I appreciate that. And I just want to say publicly thank you to her for doing that.
Thank you.
And I particularly love the lunch.
You got 3 cooked
I just go follow 2 minutes and it's time to go with what Bill just said, but we were very conscientious in asking you to serve on this board. And it wasn't just because you're just a psychiatrist or just a nurse or just a pharmacist, but because you're system thinkers and you're so engaged in the community in so many ways. And I'll say, I lobbied Commissioner King hard to come on this board because he brings a business, economic development perspective that strengthens me as a leader, my team as leaders in the board, versus looking for a commissioner who had more of a health and human service background. We have to think about the $500 million industry we are. But we really want to spend next month hearing from you about how do we pull your individual talents, because each of you came to us. We've asked you to come to us and serve in this way because you do have those talents in that specific area of expertise, and we just want to have an informal conversation about how do we best use that and how do we make these meetings interactive. So in your packet from Krista, it'll tell you where to go, and you'll get lunch on the road, and there's small break.
Well, so let me do the same care like this.
You'll give me the right bill.
Yeah.
I give him 1 cookie.
There's always the 4th Friday of the month.
We will get you back in our schedule. We're always grateful to have other commissioners join us. Thank you for your interest in what we do.
I'm glad to have you here. Any other announcement? Let's see, do you have a motion that we adjourn? Oh, you want it? Second. All those in favor? Aye. Anybody leave?